right.
Thank you, everybody, for joining us for the MSN Nurse Practitioner Virtual Information Session. My name is Tom Kresh. I am our Director of Graduate Admissions here at Commonwealth University, and I'll be the host for the night. We have a great event where you'll have an opportunity to preview your experience in our graduate program in Nurse Practitioner. Certainly have a lot to offer. I know Dr. Schaefer has a tremendous presentation prepared where we'll run through the presentation, and then afterwards we'll open it up to a Q&A if you have any questions. I know Dr. Schaefer is a great resource here. This event is being recorded, so whether you're watching live or you're watching the recording, we appreciate you taking time out of your busy schedule to join us, and feel free to follow up with questions. The event should take between 30 and 45 minutes, I would say. But before we go any further, Dr. Schaefer, would you mind introducing yourself?
Sure. All right. Well, thank you, Tom. So hi, everybody. My name is Jennifer Schaefer. I am a family nurse practitioner. I'm the coordinator of the nurse practitioner programs here at Commonwealth University. I'm also a graduate of our program. I won't tell you the year because I don't want to date myself, but it's been a while. So I'm a graduate of our program. I have been working with the nurse practitioner program here at Bloomsburg for about 10 years now total. I hopefully you will find that we will have answers to a lot of your questions. If not, please feel free to ask questions. I think it's an exciting time. Even just the fact that you're here getting information, is an exciting time. You're thinking about expanding on your nursing career. So so please feel free to ask questions.
Yes, yep, absolutely. I know that the Briner School of Nursing certainly has a lot to offer here. Dr. Schaefer, as a faculty member, what are your areas of research, or what was your previous area of specialty?
Yeah. So like I mentioned, I'm a family nurse practitioner. So I practiced in family practice, family medicine for about 15 years. Currently, I'm practicing in an urgent care setting. When I did my doctoral degree, my main focus was on adolescents and their use of social media and how that can negatively affect physical and mental health of adolescents. Although I don't always like to drone on about the bad stuff because there's good stuff about it too. But my area of research is mostly with adolescents, also rural health care. I also work with community health. And we do focus on the health of folks that live in the rural areas, trying to increase access to care. We have a mobile unit at the hospital where I work. So we're working on hopefully, getting out in that a little bit more, getting out to some more harder to reach areas. We do community health screenings. I have a variety of interests. My nursing background, however, was emergency medicine. So it was quite a transition going from emergency medicine or emergency nursing into primary care. But I'm so glad that I did it. I love it because now I get to know my patients on more of a personal level and develop those relationships, which has been very rewarding.
Excellent, excellent. Yes. And one of the things I'm always fascinated by is a lot of our nursing faculty, yourself included, is you're not only a full-time faculty member, but you also are a practicing nurse practitioner as well. Certainly very busy, but probably can bring a lot back from what you're doing as a nurse practitioner in the field into the classroom.
Absolutely. Yes, I think that's certainly, it serves its purpose, especially when you're teaching those clinical courses, because you can bring, you're seeing what's actually, what we're reading in the textbook is one thing, but what we're actually seeing and doing in practice is important for when you get out and you're in your own practice.
Right. Yep. You can speak the language.
Yeah, definitely.
Go ahead and share my screen so we can kick off the presentation here. So the first question is, why the MSN? You're going to have prospective students who are going to be giving up free time and probably paying some money and putting forth a lot of effort. Why would someone want to do the MSN, the nurse practitioner program?
Yeah, so the MSN, obviously, the easy answer there would be, of course, to gain more knowledge, to build on your current professional skill set. The master's in nursing, especially for advanced practice nurses, it really opens up a lot more opportunity as a nurse practitioner, we become much more independent practitioners. It's a role that is not only independent, but it's also collaborative. We do have collaborating physicians that we work with, which is the law here in Pennsylvania. But you really kind of get to know more about your patients. And as I mentioned, just developing that relationship is wonderful. So, we manage care. Of course, we diagnose, we treat, we manage patients, but we're not only managing their physical health issues, but we're also looking at their social issues and financial issues. And we really have a holistic approach to patient care, which is why, I think nurse practitioners are doing so well, and we're seeing more and more of them now, which is wonderful. But becoming an advanced practice nurse, like I said, it really does open you up to so many other things, leadership, if you're interested in leadership, policy development. Of course, we do have other master's programs that focus on those areas, but I think as an advanced practice nurse, you're kind of getting involved in almost all of it, because we know that as we manage the care of our patients, we have to have a good understanding of, so many different things. Professional guidelines, policies, we have to have a good understanding of, socioeconomic issues that our patients may run into. So it's, like I said, it's been very rewarding for me. And, of course, earning higher wages is always a benefit, right? So earning more money. But there's more job opportunities. If you look at the healthcare crisis that obviously we have with the nursing shortage, the physician shortage is just going to continue to grow. So nurse practitioners are really in a great place to step in as primary care providers. And I don't like to view us as, the next best thing to a physician, because we truly are our own profession. There's so much research out there that has shown, the great things that nurse practitioners do, how well we take care of our patients. And the opportunities are just going to be endless, especially, within the next 10 to 20 years.
Yeah, we have a slide coming up in this deck where I know we're going to be talking about, like, what does the job outlook look like, and the demand for nurse practitioners is going to be astronomical. So this is a good time to be entering the field, especially because you hit on, probably among, let's be honest, among the most important things, right, is increased scope of practice and earning potential and increased job potential. So this is a good time to kind of be hitting this intersection. So
Absolutely.
yeah, absolutely. So just from a high level for students, where this may be their first interaction with our program, could you just walk us through some of the finer points?
Yeah, sure. So our nurse practitioner programs, we have two of them. We have our adult gerontology primary care, and we have our family, it used to just be family nurse practitioner. Now it's family or individual across the lifespan nurse practitioner program, but they're both primary care. The programs are 100% online, which we have found to be, I mean, as nurses, we're working, you all are most likely you're working, we're busy. A lot of people are juggling families, they're taking care of parents, we're busy people as, as graduate students, because we're adult learners. And so it's been great, I think, moving our programs to 100% online. The core courses are all asynchronous, and what that means is you don't have to log on like at a certain time or day of the week. You just kind of work at your own pace. Of course, you have deadlines and things that you have to meet, but there's no actual FaceTime per se online. And then our clinical courses, now those are synchronous. So our students do meet one day a week when they get into clinical courses. We meet as a group online, but it's great because we share clinical experiences. And I think, the discussions are very beneficial. We talk about so many different things. So the students have really enjoyed having that synchronous time as well. The adult gerontology primary care program is 41 credits, and then the family program is 50 credits. So with the family program, it is an additional semester because you're picking up that pediatric care and care of the pregnant woman. So it is an additional semester. But the coursework is very flexible. Like I mentioned, we're all busy, and most of us, you're working and you're going to school. And I know I've been there. I've done it a couple times now. My husband's praying I don't do it again. So we are flexible. We have part-time, how do I want to say it? Part-time options. We also have full-time options. And we do have students that, they might start part-time and then decide, you know what, I think I want to pick up the pace. And then they'll kind of jump over into more of a full-time option, or vice versa. You can start out off full-time, and then if you decide you need to back it down a little bit. Earlier on in the program, it's much easier to do that when you're taking those core courses online. But it's a great way to kind of get your feet wet, getting back in back into the routine of school and kind of figuring out what's going to work for you. So our coursework is very flexible. Our programs are primary care programs, so that is the focus. We don't train nurse practitioners to work in acute care settings. So, like in the hospital, like ICUs and things like that. Our programs are primary care. And as Tom had mentioned earlier, as we were talking, our program faculty, they are all practicing nurse practitioners. So you are getting, those firsthand experiences of what our faculty see in practice, and they bring that into the classroom with them. And just staying on top of, because we know healthcare changes, so rapidly, the nursing field changes so rapidly. So our program faculty are on top of, what is considered the best practices.
Mm-hmm. Mm-hmm. Yeah, I think one of the nicer parts about the program too is that you can kind of meet the student where they're at. They want full-time, you've got that opportunity. If you want part-time, you can do that too. Classes delivered online. So kind of regardless of the circumstances that they're in right now, the program, again, really can kind of meet them where they're at.
Yes. Yes. And I would just put a plug in there for the faculty as well. We're all very accessible and very supportive. I can tell you almost all of our faculty, we share our cell phone numbers. We're available, by many different modes, email, cell phone, texting, whatever, because we get it, as an adult learner, we certainly understand the need for the flexibility.
Well, and that's probably among the best points too, where you mentioned that all of the faculty members, sometimes they may have all have gone through our program, so they know what they've been in your shoes before, right? But you're also practicing nurses too, right? You're also a nurse practitioner, so you understand what this is like, and so it's more of a collegial relationship that's somewhat consultative. Again, where you can kind of meet them where they're at.
Right.
I think that probably helps the completion rate for a lot of our students too. I would imagine that, for students that start, they probably all finish
Yeah.
because of that
Yeah.
rate.
Yeah. We have a very high completion rate.
Yeah, and then that gets us into the adult gerontology primary care option. Now, this is one of the concentrations within the degree.
Mm-hmm. So with our adult gerontology program, so these practitioners care for patients that are age 13 and above. So adolescents, young adults, older adults. Our coursework is, our pharmacology courses, our core courses are across the lifespan. And then when you branch off and start those clinical courses, then you will be more specified and more, the adult gero program, your clinical courses are going to be more specific to that particular age range. But graduating from this particular program, our graduates, they have the capability of going into community and hospital-based primary care clinics, internal medicine clinics. Some do work in family practice, but they just, they don't see the younger children. They just, see the children that are 13 and above. But patient homes, and also, skilled nursing facilities, long-term care, palliative care is a great setting for nurse practitioners. They do very well in palliative care, hospice care. So there's a lot of opportunities for adult gero. Again, the adult gero nurse practitioners, we work interprofessionally with other team members, just like we do, as a nurse. So, any healthcare provider, they should be working interprofessionally. And I think our programs really, we really try to capture the importance of that. And, we know that our patients have better outcomes when we work interprofessionally.
Mhm. Yeah, absolutely. And then that gets us to the family individual across the lifespan.
Yes. So our family program that is across the lifespan, from birth until death. Our program prepares graduates, again, to value collaborative family-centered care, as well as interacting among the physical, emotional, mental, and sociocultural systems of patients. So as I was talking earlier about that, that holistic care that we provide to our patients. This program, a lot of our graduates go into family practice settings, pediatric settings, pediatric primary care offices. We have a lot that, may decide that they want to specialize in, pediatric endocrinology or, there's just so many different specialties that you can also branch off into if you decide that you don't want to be in a family practice type of setting. Yeah, so lots of opportunity.
Yes, yep, absolutely. And then that gets us to the coursework.
Okay, so our coursework, we do have the core courses. So the core courses would be, of course, your theory. We have our theory course. We have another theory course that's more specific for the family nurse practitioners. We talk more about family theory in that course. We also have epidemiology, research, and the diagnosis and management of our adult patients. That would be the first clinical course that you would take. That course all of our clinical courses have 210 clinical hours in them. We do have the comprehensive assessment of the older adult. That is more of an assessment course where you're not focusing as much on diagnosing and managing, but it's more, more on advanced physical assessment. That one's 140 clinical hours. And then epidemiology and population health is one of the more core courses. And the family practicum and seminar. So that is the final course that our family nurse practitioner students would take. And then there's also a practicum and seminar course for our adult gero nurse practitioner students. So with our clinical courses, what we do in our program is we combine the lecture and the didactic work along with the clinical. So what you're learning in class, you're taking with you to the clinical setting. So for instance, if you're in diagnosis and management 1 of the adult, and and you're talking about the respiratory and the cardiology system, you can take what we're talking about in class and what you're learning as far as assessment and building your diagnoses and getting a good history, and take that right into the clinical setting and kind of work on those things. So I think it really kind of enforces what the discussion is in class. So I think that's a little different about our program. Some programs, they do all the didactic stuff first, and then you just have clinical practicums at the end. But with this, it's we kind of intertwine that didactic in along with the clinical, which students have felt that to be very beneficial.
Mm-hmm. So Dr. Schaefer, question for you. So as students are, again, oftentimes balancing work, the personal life, what is the normal amount of hours or the time commitment that you may think a student would typically put forth in a given semester?
So at first, with those core courses, like I said, it's really going to be more dependent on the student as far as what their schedule is like, and how much time that they have. Some nurses, we tend to be a little type A, or maybe a lot of type A. So if you want to kind of stay, get ahead, really, I mean, you would be looking at, you're probably spending anywhere between 5 to 10 hours a week in your core courses, When you get to the clinical courses, you do have to allow yourself 2 days a week for clinical, which, can be challenging if you're working full time. So that's something that you would want to think about and you'd want to plan for, because, there are there's 3 clinical courses in the adult Gero program, 4 clinical courses in the family program, and those are all 210 clinical hours per semester, which equates to about 2 days a week.
Mm-hmm, mm-hmm. And so for students, again, that they're going to have completed a BSN, what's the difference between the BSN classes or bachelor's degree level coursework and the master's degree level coursework?
I would say that there's more scholarly writing. We do more writing. Everything that we do as nurse practitioners is based on evidence. So we talk a lot about evidence-based practice. I think in your bachelor's program, when you graduate with your RN, with your BSN, you have a good base for nursing. And then of course, with our experience, depending on where you're practicing, you build on that base that you received during your bachelor's degree. But then when you get into the master's program, you're really delving more into kind of the why we do things, which I think we lack a little bit in the bachelor's program, but it's definitely much more in depth. The work is more scholarly. You're doing more writing. So I think it's just a higher level of learning, a higher level of understanding. You're doing more critical thinking. Yeah.
And how do the asynchronous courses work? For someone who may have not ever taken asynchronous classes, how do you typically facilitate them?
So for our asynchronous courses, like I said, those, where the students don't have to meet at a certain specified time online. What is nice though, is all of our faculty, we tend to set our courses up pretty much the same. So whether you're in a synchronous course or an asynchronous course, we use the same learning platform, and the courses are set up by week. So week 1, you'll have your assignments. Of course, you have a weekly schedule, you have your syllabus or your outline. But you will have specific deadlines for assignments and things like that. We have drop boxes that we use, right inside the course that you submit all your assignments. So it's very organized. I think we've gotten it to the point now where almost all of the courses are organized pretty much the same. So you're not searching. And I think that's probably one of the things that a lot of students who haven't taken an online course before, they get anxious about. It's just kind of overwhelming when you first get in there, and it's like, where do I find the schedule? Where do I find, my assignment for today? Where do I find this project? And it is very, very well organized. Mm-hmm. And like I said, the faculty are all very accessible. We all have online office hours. You can reach us by email. So, we certainly do expect those questions, especially initially, from students who haven't taken online courses before.
Yeah. Great, thank you. And then again, we kind of referenced this earlier, but the job outlook, very, very promising.
Yes.
What's the work that goes into getting the degree?
Yes, you don't need to worry about not having a job when you graduate from a nurse practitioner program. That is for sure. It all depends on, where you want to work. A lot of our students end up actually going and working, at a site where they did clinical. They found a preceptor. They developed great relationships with their preceptors. Some students will do more than one semester of clinical with their preceptor, and they just, kind of that end up landing, at one of their clinical sites, which is great. But yeah, there's so many job openings. The certification, we prepare our nurse practitioners. You can sit for both certification. What do I want to say? There's the American Academy of Nurse Practitioners, and then there's the Nursing Credentialing Center. So our nurse practitioners are prepared where you can sit for either one of those board certification exams. But you can see here on the slide, the demand for nurse practitioners is projected to grow 45% from 2020 to 2030. and I can see that number even going up more. I mean, with the baby boomer population, we talk a lot about baby boomers, but they really are going to have a huge impact on our healthcare system. And with the physician shortage, we're ripe for the picking. Really, you can pretty much go anywhere and work that you want to work when you graduate.
Yeah.
And I know when I graduated, it was, there weren't a whole lot of nurse practitioner jobs, and it wasn't negotiable. I mean, you were pretty much given a salary and that's that. It's totally not like that anymore. I tell my graduates all the time, just remember that you are interviewing the employer just as much as they're interviewing you, because, you have lots of opportunities.
Mhm. Yeah, when you see that the demand between 2020 and 2030 is going to be 45%, like normally
Mhm.
between like 5 and 10% is very big.
Yeah,
45% is astronomical. Like that
yeah,
is
huge.
huge. Yeah. So when we talk about job opportunities and supply and demand and what that could do for your compensation, like those numbers add up in the favor of the nurse practitioner
Mhm.
for sure.
It's
Yes.
one of the hottest jobs. Almost any platform that you look at, it'll nurse practitioners right up there.
Yep.
Yeah.
For good reason. Absolutely. And then some of our recent alumni, Dr. Schaefer, what directions have they gone in?
Yeah. So, like I briefly talked about earlier, our alumni, they really go into all kinds of different practice areas. Family medicine, internal medicine, lots of specialties. We have, we've had students go into addiction centers. We've had students go back and decide that they want to get a postmaster certificate and, like, psych mental health or acute care nurse practitioner. So really there's just all kinds of settings, and your certification is a national certification. So when you take your boards, it's kind of like when you take the NCLEX, it's a national certification, and then if you move wherever you go, you would just have to transfer your license. So there's just all kinds of opportunities. Skilled nursing facilities. We're seeing more and more care within the home now, which I think is a great thing. But we've had a lot of our graduates go into in-home primary care programs.
Mhm.
So that's kind of another thing that we're seeing. Telemedicine is also huge. There's a lot of companies out there that are looking for nurse practitioners, to do primary care, but through telehealth. So there's just, I think it's just going to continue to grow. So we're going to see more and more opportunity.
Yep. And then the fun stuff, the application and the admission process, Dr. Schiffer, what are you typically looking for in a qualified applicant?
Yeah, so it's real easy to find the application. It's right on the nurse practitioner website. We would need your college transcripts, of course, from your undergraduate, um, from your bachelor's degree, and then your copy of your current unencumbered Pennsylvania professional nursing license. We would just need a copy of that. Your resume, describing your professional nursing experience and what clinical experience that you have. We do require 1 year of acute care nursing experience.
Mhm.
Um, that word acute care sometimes I think confuses people. Basically, that just means, if you're working in a hospital, any type of acute care setting, because you do want to have you need to have that 1 year experience to have a good baseline as a professional nurse, before you would go into the clinical setting, with with a preceptor.
Mhm.
We do have students that come to us, right out of bachelor's programs, and that's okay as long as they have that 1 year experience before they would start their clinical courses.
Mhm.
Also, 3 completed recommendation forms. So whether that be, a colleague that you work with, a supervisor, we would like to have 3 recommendations. And then what are your goals? So what is it that you would like to achieve in the nurse practitioner program? Kind of where do you see yourself working, when you finish the program? And a lot of people don't really know. They start the program and they think that maybe they're gonna work in a skilled nursing facility, or they really like geriatrics, and then they find, what, I love adolescents or I love pediatrics. They decide to do the family nurse practitioner. So and really the goal statement is just to make sure that, you are in the right type of program, because we certainly don't want you to waste your time and then, thinking that you're being prepared for, um, a position in an ICU when we prepare you for primary care. So we want to make sure that you are in the right program and that we can provide you, with what your career goals are. So we can make that happen for you.
Yeah, and I should say that we do accept applications for spring, summer, and fall enrollment as well.
We do. Yes,
So
we have rolling
essentially,
admissions. Yep.
yep, yep. So regardless of the semester you're looking to start, we are accepting applications. And then Dr. Schaefer, your contact information for anyone who may be watching and has some
Yeah.
additional follow-up questions.
Yes. Yeah. So please feel free. That's my office number there. You can certainly give me a call there in my office. My email is probably going to be a better way to get in touch with me. I'm kind of in and out so much of the office. So there's my email address. As you can see that there's not an R on the end of Schaefer. So, but yeah, shoot me an email if you have any questions. I would love, and even if you want to chat on the phone, shoot me an email. I'd be more than happy to pick up the phone and have a conversation with you to answer questions.
Yeah, and I'll go ahead and stop the share, and I think that's where we can get into the open Q&A. So for anyone who is watching live, if you have any questions for Dr. Schaefer, this is a great time um, to pose the questions. Feel free to put them in the chat or in the Q&A. And I know, so Dr. Schaefer, typically, we hear a lot of questions on our end on the front, on the front of things in admissions. I know normally one of the questions we will hear often is how much time do I need to spend working as a nurse before I can apply? Or can I apply directly after completing my BSN degree? Would you be able to
Mhm.
speak to that experience?
Yeah. So you can apply directly after completing your BSN.
Mhm.
The only requirement with that then would be that you are practicing as a registered nurse while you're starting your master's courses, because you need to have at least that 1 year experience before you get into the clinical courses and you're actually, in clinical settings.
Mhm.
But yeah, it's, 1 year is really all you need to have. And, is we also have nurses that have applied and that have come into our program that they've worked in primary care offices. They graduated with their bachelor's and they've worked in a doctor's office. And that's okay too. We consider that acute care experience, just so you have that nursing experience.
Uh, Yes. So, normally some of the things that we will also hear, and again, as the people who are watching live are possibly thinking about questions. I know, for instance, another one that we will often hear is if I've been out of school for a little while, what is my transition back? So, like, if I completed my BSN degree years ago, what's the transition like going to be back into graduate school, into learning management systems? Have you found it that people who are returning to school after a little while have been able to navigate that transition well?
Oh yeah, definitely. And I think that's another benefit of starting off with the core courses.
Yeah.
Our core courses, we have revamped our curriculum over the past couple years, and we do offer 7-week courses now for our core courses.
Mhm.
So those 501, 502, and 503, those are the first 3 courses that you take, which is a theory course, an epidemiology course, and a research course. And they're all over 7 weeks, it's a great way to get your feet wet, especially coming back after being out of school for a while.
Mhm.
Because you can take one course the first 7 weeks, and then the second 7 weeks you can take another course. So you're only taking one course at a time and only
Mhm.
having to focus on one course at a time. Or if you decide you want to go full time, I mean, we can, you can certainly, take more than one course at a time. It's really whatever you're comfortable with. But we do have a lot of nurses that come back after being out of school for many years,
Mhm.
and they do well. I think the hardest thing is just kind of is time management.
Mhm. Mhm.
Especially if you have children or you have other obligations, other things that you have to do. You want to be successful, and we want you to be successful. So, and
Mhm.
that's certainly a conversation that we have. As
Mhm.
far as recommendations on how to manage your time.
Dr. Schaefer, I know at the doctorate level at in the Briner School of Nursing at
Mhm.
Commonwealth U, we have a doctorate program
Yeah.
in advanced practice nursing. Do you
Mhm.
find that a lot of our students that graduate from this program then go on to complete their doctorate degree? And if so, what are some of the advantages of having the doctorate?
Yes. So we have had several of our students, nurse practitioner students, go on and get their DNP, which is a Doctor of Nursing Practice degree. Um, it's very beneficial, especially if you want to be in like a leadership position.
Hmm.
Um, you know, as nurse practitioners, as nurses, really, I think that our voice hasn't really been heard. We haven't really been at the table with the physicians and making those policy decisions that and we need to, right? Because we have uh, if you put a room full of nurses together, we could probably solve a lot of the issues with our healthcare system. Okay, we know that, but we need our voices to be heard. And in order to do that, you really, we want to sit at the table with the physicians and the other doctorally prepared healthcare professionals that are making those decisions about our healthcare system and about healthcare in general. But really, leadership positions, a lot of them will require a doctorate, or certainly it's advantageous to have a doctorate. Or if you
Hmm.
decide you want to go into education, like myself, um, the DNP program, it's a practice program for nurses. So it's not a research doctorate, it's a practice doctorate. But if you want to continue to practice and teach, a DNP would be great.
Hmm.
So again, there's lots of advantages. And I will also say that our accrediting body, they look at the recommendations for nurse practitioner education, um, that to set standards.
Hmm.
So what they are saying now is actually a 2025. It didn't happen yet, but 2025 was when they were going to recommend that entry level nurse practitioners had doctorate degrees.
Hmm.
So it's coming. It is coming, where we're going to see that, and we're seeing that with other disciplines as well.
Hmm. Hmm.
So yeah.
So, Dr. Schaefer, for prospective students that may be looking at the suite of options that they can pursue in the form of an MSN degree, they may be looking at, the MSN informatics or an MSN
Mhm.
MBA, or there's all these different subspecialties.
Yeah.
What is some of the defining features for a student who would be a good fit for the MSN nurse practitioner program? Like, is there anything amongst your travels or discussions with other students where it's like, well, if you like to do X, Y, and Z,
Mhm.
you'd be a good fit for us. Maybe
Mhm.
not the other programs as much, but for the nurse practitioner programs, you're a great fit based on what you're interested in.
Yeah. I think it comes down to that hands-on patient care.
Okay.
So, if that's what you love, you love that direct patient care, that one-on-one patient care, then the nurse practitioner program will certainly provide you with that. We do have other programs. Nursing informatics is certainly that is growing. We're seeing more and more of that, which is great, because you have these EHR systems, and nurses need to be the ones developing these EHR systems, right? We're the ones using them and understanding them, and making recommendations for changes. So that's a very growing field.
Mhm.
And then we also have our administration program for nurses that they like to be leaders, for nursing leaders, and they're already in administration positions. They want to go on to get their master's degree. So it really just kind of depends on, where you want to go with your career. But for the nurse practitioner, for that hands-on patient care, that managing the health of your patients, and developing those relationships is, really the
Mhm.
backbone of the nurse practitioner.
Mhm, mhm. We have a good question here from Arena. How many core courses slash credits are there? She would be a direct entry from the BSN, so I'm trying to determine how much of the program could be completed while I'm in that required year of acute care experience. It's a great question.
Okay, that's a great question. Um, So the core courses, let me think. I got to think here. I got to do math in my head. So the core courses, you're going to have the 3 courses that all master students take, which is 501, 502, and 503. And then you would also have pathophysiology, advanced pathophysiology, and advanced pharmacology, and then an advanced health assessment course before you move into the clinical courses. So you're looking at probably 21 credits of what we consider kind of core courses before you would start your clinical. So even if you were doing that at a full-time, if you came in as a full-time student, well, actually, if you came in as a full-time student, you would start your clinical courses that first year. Okay, so the second semester of your first year. So if you don't have that year experience, you would most likely have to come in as part-time, and you would start your clinical that second year.
Thank you. Yes, thank you.
Mhm.
That's a great question. I appreciate
Yeah.
you asking. I don't see any additional questions in the chat or the Q&A. So Dr. Schaefer, do you have any parting advice before we log off for any prospective students who may be considering the program?
My parting advice would be, when you're choosing a nurse practitioner program, make sure that it's something that is going to fit your educational goals. Make sure that you do your research. Our pass rates, we do have 100% pass rate on our certification exam. Last year, we 100% for our adult Gero NP students and 100% for family. That's important because you want to be in a program that's going to prepare you well because you want to be successful. And, just like that NCLEX, we got to get through that certification exam. But I applaud you for being here because you're taking the next step in your nursing education. And I encourage you to do that because you won't be sorry. That's for sure. Yeah. It's, nurses. I think most of us that are nurses, we can't imagine doing anything else. And taking that next step as an advanced practice nurse, will really be beneficial to you in your nursing career.
It seems like, yeah, this will be a good investment in
Absolutely.
future
Yeah.
careers. I'm sorry, there is one more final question here. Does the program provide access to preceptors, or do people ever have to find their own? That's a great question.
Okay. So that's a great question. We do have students find their own preceptors. However, we assist with that process. I just actually sent at the beginning of every semester, I send an email out to all the students, and actually my email just went out today, with recommendations for preceptors based on preceptors that our students have gone with in the past that we know are good preceptors. So we do provide you with recommendations. We don't place students because our students are from all over the state. And we'd like you to do your clinicals, close to where you live because, you're working and you have other things going on. So yes, we do assist, but students do their own placement.
Great.
Yeah.
And everybody, thank you for joining us if you're watching live or watching the recording. We definitely look forward to hearing from everybody in the future, and I hope everybody has a great night.
Yeah. Thank you very much.
Everybody.